So there are two types of studies: interventional studies and observational studies. Uh, Interventional studies are those in which an intervention is done, such as a drug is given to the patient and then they are observed. And observational studies in which we do not intervene, we just observe different population groups and then we record our results. Observational studies can be divided into three types: prospective, snapshot, and retrospective. Prospective is that prospective studies are those, an example of prospective studies, prospective cohort study, that is a group of people is followed over time in the future. So starting from today, we will select a group of people and then we will follow them for a certain period of time to calculate our observations. Snapshot study example is cross-sectional study. Cross-sectional study is done in the present. And retrospective studies, they are done in the past, or they are done on the so past, present, and future. The cross-sectional study is done in the present. That's, for example, we'll select a cross-section or a population, and then we'll see the association of certain risk factor with certain diseases. That is cross-sectional study. And if we select a group of people and then we follow them or we study their past, then this is known as a retrospective study. Example of retrospective study is case control study and retrospective cohort study. And the third type of study is prospective cohort study. That is a group of people are selected and they are followed for a certain period of time in the future. So the different type of studies is different. So this is how you can differentiate between cross-sectional study, prospective study, and retrospective study. Now, prospective cohort study is easy to identify. Cross-sectional study is also easy to identify because if we follow a group of people for a certain period of time in their future, then it will be prospective cohort study. So to pick questions about prospective cohort study is very easy. Similarly, questions about cross-sectional study are also easy. The difficult thing is how to differentiate between case control study and retrospective cohort study, because they are done by studying the past of the patients or group of people. So the difference, how you are going to differentiate between case control study and retrospective cohort study, it's very simple. If the study start from the outcome, for example, we select 100 people who have or who had developed myocardial infarction. So in case control study, we will have two groups. Similarly, in retrospective cohort study, we will have two groups. What will be the two groups in case of case control studies? As I told you that case control studies start from the disease or outcome. For example, we have selected 100 patients who had MI. Case control study start from outcome and it try to look for the cause of that outcome, such as what were the things that led to MI in those 100 people. They will be asked questions about their lifestyles and their medical history, such as if they were smoker or not. So a study that starts from outcome and it try to look for the cause, it will be case control study. On the other hand, if the study start from exposure and then it try to look for the outcome in the past, then it will be retrospective cohort study. For example, in retrospective cohort study, we will define the exposure. For example, someone working in the shipyard industry, in which there is exposure to asbestos. So we'll start with asbestos exposure, and then we'll look into the data that how many of the people with asbestos exposure develop the mesothelioma or lung cancer. So this is how you can differentiate between case control study and retrospective cohort study. That in case control study, we start from the disease and then we try to look for the exposure. So one thing you can say from this discussion is that in case control study, it is only one disease can be studied. For example, we selected a population who had MI. So only one disease can be studied at a time, but we can study multiple exposures, because the group that we have selected of 100 people who had MI, there can be multiple risk factors associated with that disease, such as with MI, it can be smoking, sedentary lifestyle, high cholesterol level, a history of diabetes or hypertension. So multiple risk factors can be studied in case control studies, but only one disease at a time can be studied in case control study. While in retrospective cohort study, because they start from exposure, so multiple exposures can be studied. Because they start from exposure, so only one exposure can be studied at a time. And because we are looking for, we see the outcome. So multiple outcomes or multiple diseases can be studied in retrospective cohort study.
So if,
So
for
the difference,
example, instead of asbestos, if the exposure is for something else, so
the exposure can be, let me give you another example. We know that COCP, they can lead to DVT.
yeah,
Is that right? Is that right?
yeah, yeah.
So if we select a group of people who used COCP, so it means we are starting from the exposure.
Right.
And then we study their medical history or their file history in their file, and see if they had developed DVT and during some time of their life while using COCP. So it will be a retrospective cohort study. You need to remember just this one point. If that study starts from the exposure, then it will be a cohort study, retrospective cohort study. And if it starts from the disease, then it will be a case control study.
Right.
Another example could be that we select 100 people who had smoked for 30 years. So we have selected 100 people who have smoked for 100, who have smoked for 30 years. We have defined the exposure at the start of the study. So we can only study one exposure, that is smoking. We'll only select those patients who has exposure to smoke. And then we'll see from their medical records that during those 30 years, which diseases they had developed due to smoking exposure. So this will be a retrospective cohort study. And the advantage of retrospective cohort study is that only a single exposure can be studied, but multiple outcomes can be expected, or multiple outcomes, because smoking can cause lung cancer, smoking can cause cardiovascular diseases, smoking can cause bladder cancer. So in the retrospective cohort studies, one exposure because we from the disease such as MI or lung cancer or DVT, and then we study their past to see what was the exposure. So one disease can be studied at a time, and multiple exposure can be studied in case control studies. So these are the some difference between case control studies and retrospective cohort studies. I hope it's clear now.
Yes, it is. It's clear. Yes.
So case control studies are retrospective. Retrospective is that they look back to assess whether there is a statistically significant difference in the rates of exposure to a defined factor between the groups. So case control studies are retrospective. We clearly define two groups at the start, one with the outcome and one without the outcome. That one with the disease and one without the disease, and then we'll look back to assess if there is any association between different risk factors and the disease. Similarly, in retrospective studies, we will define two groups. The only difference between these two is in case control studies, we get start from the disease, and then we look back to see if a certain exposure has a significant outcome. While in retrospective cohort study, we start from the exposure and then we look back to see if someone has developed a disease or not. The main outcome measure in case control studies odds ratio. So two groups are defined, outcome and no outcome, and then we look back to see if a certain exposure has caused this disease or not. We start from the disease and we look back for the exposure. Now, what are the advantages of case control studies? They are cheaper, they are quicker to it is good for disease with long latency periods because we start with the outcomes. So we'll only select those patients who has already developed the disease. And then we'll ask them questions about their lifestyle or their risk exposure. Can assess multiple exposures. We discussed that as well. And it is good for rare diseases because we are only including the patient who has the disease. So it is good for rare diseases. For example, we will select 100 patient with a rare disease like cystic fibrosis or something like that. So it's good for rare diseases. Now, what are the disadvantages? Disadvantages is that retrospective, it is retrospective and more prone to bias. That is the recall bias. someone may not correctly recall the exposure to a certain risk factor. So this is a disadvantage. Another disadvantage of case control study is that it can only assess one outcome or a disease, because we start from the disease, so only one disease can be assessed at a time, cannot establish risk, and cannot establish prevalence. So these are some advantages and disadvantages of case control studies. The reverse of these advantages and disadvantages is true for cohort studies. Now, cohort studies is we select two group of people, one who are exposed and one who are not exposed. For example, we select 100 people who are smokers and 100 people who are not smokers. And then we follow them for a certain period of time, for 10 years, 20 years, or 30 years. And then we see the outcomes, that what are the outcome of this smoking exposure. Cohort studies are mostly prospective. Retrospective cohort study are done, but very rarely. So when we talk about cohort studies, will be mostly talking about prospective cohort studies. The advantages of prospective cohort studies that it can establish a risk directly, can assess multiple outcome or diseases, because a certain risk factors such as smoking can cause multiple diseases, so it can assess multiple outcomes or diseases. It is good for rare exposures, because we are starting with the exposure and we are selecting a group of people with a certain exposure, such as uh, people who has an exposure to asbestos, or people who are working in a shipyard industry. So it is good for rare exposures. Disadvantages are that it is more expensive, because to follow a certain group of people for 20 to 30 years is an expensive thing. It is longer and harder to conduct, and it is not good for rare diseases, and not good for diseases with long latency periods.
What is the last thing is not good for latency period? What does that mean?
Not good for diseases with long latency periods.
So what does that mean?
If a disease has a long latency period, for example, let's say a disease has a latency period of almost 30 or 40 years.
Right.
So it will be difficult for observer or for doctor to observe a patient for this long period.
Oh.
So this is a disadvantage. It is good for diseases with short latency period. For example, if a disease has a latency period of 1 year or 2 year or even 5 years, then it will be good to conduct a prospective cohort study.
Okay. Thank you.
Retrospective cohort is when already has determined the exposure. So it starts from the exposure and then it look back to see if the person has developed the outcome. All the three studies, case cohort, retrospective, case control, retrospective cohort, and prospective cohort, are observational studies. For example, two groups are followed over 10 years to see exposure to a certain factor would cause pulmonary disease or not. So what type of study is this? Two groups are followed over 10 years to see exposure to a certain factor would cause pulmonary diseases or not.
It's a retrospective.
Retrospective
Pro-
case control or retrospective cohort?
it's cohort.
It's a cohort studies because we are starting with the exposure. Now tell me, is it a retrospective cohort or prospective cohort?
It's as it is followed over a period of 10 years, then it's a retrospective cohort.
Retrospective cohort is when we try to look back or when we try to look at the past.
So it's
While prospective,
Yeah, this is prospective.
prospective is when we follow a patient or a group of people for a certain period of time.
Right.
Retrospective cohort studies are usually done on the already saved data. For example, let's take this example that we follow these two groups for 10 years and then we record our observation. And
Right.
see if the exposure has caused pulmonary diseases or not. Then after 10 years or 15 years, someone else want to study the same disease or exposure, then he will just uh, study this data. So that will be a retrospective cohort study. In other words, retrospective cohort study is done on the already saved data.
Right.
The exposure and the disease has already occurred in retrospective cohort study. We just need to do some calculations and to see the association, etc. So this is a type of prospective cohort study. In prospective cohort, we follow the group from the scratch over time and see what are the exposure and the outcomes. In retrospective cohort is when we already has determined the exposure in the study cohort and tries to study association of exposure to disease outcome within that cohort in a retrospective manner.
So the odd ratio is done for the retrospective.
Odd ratio is for case control studies and risk ratio is for retrospective cohort studies.
Right.
Odd ratio is the number of odds of someone getting a disease. For example, if we have 10 patients, then and out of 10, 4 or 5 got the disease and 5 does not got the disease. So the odds will be, let's suppose 4 got the disease out of 10 and 6 does not got the disease. The odds will be 4 over 6.
Right.
Similarly, if we divide this odds of the exposed group and non-exposed group or diseased group or not diseased group, then it is known as odd ratio. And risk ratio or relative risk is if 10 people, if 4 out of 10 got the disease, then relative risk will be 4 over 10 and not 4 over 6. This is a minor difference between odds and odd ratio and risk ratio.
Right.
That in calculating risk ratio, we divide the patient over the total number of people present in that group. While in case of odd ratio, where we calculate, we divide the people who got the disease over those who does not got the disease and not the total number of people.
Right.
So this is a minor difference between these two, which you do not need to remember for Plab 1.
Right.
this is the point I was talking about. In retrospective cohort studies, the exposure and outcomes have already happened. They are usually conducted on data that already exists from prospective cohort studies. So retrospective cohort studies are done on the already saved data that is saved while doing a prospective studies. So all of these three types of studies were example of observational studies. Now, randomized control trial or interventional studies that when the introduction of an interventional in a study is, if there is an introduction of an intervention in a study, then it will be labeled as randomized control trial. Two groups of smokers are followed over time. Now, two groups of smokers are followed over time. Up to this line, or from this line, we can say that it is a prospective cohort study. Now, one group is taking drug A, while the other group is taking placebo. So because there is an introduction of a drug, so this is now a randomized controlled trial. They are then followed over time to see who would develop lung cancer. So you can see that in prospective cohort study, we only observe the risk factor and look for the outcomes. While in randomized controlled trial, there is introduction of an intervention. Like in this example, that two group of smoker, one was taking drug A, while the other group was taking a placebo. So if this type of scenario is given, then your answer should be randomized controlled trial and not prospective cohort study. Now, some questions about sensitivity and specificity. High sensitivity means few false negative. Like we did in the example that out of 100 patients, 80 were true positive and 20 were false negative. If out of 100, 60 are false negative, then what will you say about the sensitivity of this test? Out of 100, 60 are false negative. It means the sensitivity of this test is low.
Right.
So sensitivity of a test can be calculated from false negative results.
Right.
So if there are many false negative, then we will say the sensitivity is low. And if there are few false negative, then we'll say the sensitivity of the test is high. So the sensitivity of a test can be calculated from false negative result, and specificity can be calculated from false positive results. Remember these two lines.
Right.
There is inverse relation between sensitivity and false negative, and specificity and false positive. Few false negative means high sensitivity. Many false negative means low sensitivity. Inverse relation between these two. Is that right?
It's not clear.
Let me use the whiteboard, then it will be clear. So sensitivity was from 2 by 2 table. whenever you encounter a question of about sensitivity and specificity, then make a 2 by 2 table, positive and negative. 100 patient, 20, 5 and 95. This is the example that we did. Now, what was sensitivity? Sensitivity was true positive divided by true positive
Positive and
plus false negative.
okay.
Is that right?
Yep.
So in this table, you can see that if the number of false negative is increased, for example, instead of 20, the false negative are 60, then true positive will be 40. You
Now
can
they
say
have
that
more.
false negative, yes, false
It is
negative
more.
is in the denominator. False negative is in the denominator. So if the number of false negatives are increased, then sensitivity will decrease.
Right.
Is that right?
Yeah.
So few false negative means if false negative are few, then it means sensitivity will be high. Is that right?
Yeah.
High sensitivity mean its ability to detect truly sick patient is high because there are few false negative. Similarly, for specificity, we'll see false positive. If false positive are few, then specificity will be high, and if false positive are many, then specificity will be low.
Right.
So two things you need to remember, that sensitivity is inversely related to false negative. Is that right?
Yes.
And specificity is inversely related to what?
False positive.
Yes, false positive. That's right. Just remember these two formulas.
Right.
Specificity inversely related to false positive, sensitivity related to inversely related to false negative.
Negative.
Low false negative means, or few false
High
negative mean high sensitivity.
sensitivity.
Many false negative mean low sensitivity.
Low sensitivity.
If this is high, this will be low. If this is low, this will be high.
Right.
Now let's do an example. A new test, AD test, to diagnose Addison disease is being tried on 1,000 patients. 900 of them show positive AD test. Only 100 of these 900 are diagnosed with Addison disease. So a new test is advised that is known as AD test for the diagnosis of Addison disease. It is tried on 100,000 patients. Basically, it is a screening test. So this screening test is tried on 1,000 patients, and 900 of them showed positive result. Only 100 of these 900 are diagnosed of. So out of these 900, only 100 truly had the disease. So what you can say about this test?
So the 100 are true positive. So
Yes, out of 900, only 100 are true positive. And what about those 800?
they are false negative.
They are false positive
False positive.
because
Yes.
they have a positive test result.
Yeah.
So you can say there are many false positive. Out of
Yes.
out of 900, 800 are false positive. So the number of false positive is very high. So you can say that this test has a low
Specificity. So
high
is
false
it
positive rate, low specific. Yes,
so specificity will be in that case it will be high specificity because there are more false positive.
more false
So then
positive
it will be
means
low specificity.
yes, specificity will be low because there's an
Low
inverse relation
inverse
between
relation.
false positive. I told you the concept behind it,
Yes.
but you can remember straightforwardly by this formula.
Right.
Because in lab one exam, you will just only have 1 minute. You won't
Hmm.
have time to think about the concept. So just
Right.
remember this one,
Okay.
that false positive is inversely related to specificity and false negative is inversely related to sensitivity.
Sensitivity. Yes.
Now another example, a new test called LNC9 is being tested on 10,000 people to diagnose lung cancer. 700 of these show positive LNC9. Out of these, out of these 700, 670 were positive on lung biopsy. So if they are talking about positive test results, is that right?
Yes.
So most probably it is a question about specificity because they are talking about positive test result and not a negative test result.
Yes.
So 700 are positive. Out of these 700, 660, 670 were positive on lung biopsy. Again, whenever you see a question about sensitivity or specificity, you will see two types of test mentioned in the question. One will be a screening test and one will be a confirmatory or diagnostic test.
Yes.
So what will you say about this test LNC9?
So lung cancer, so these show. So 670 were true positive, and 700 were they were 700 were diagnosed with the
The screening test.
screening test. Yeah.
So
So
out of these
630.
700, how much are false positive? 30 are false positive. So 30 false positive, are they many or are they few?
They
Out
are
of
few.
seven, yes. So few false positive mean
Means that it's a high specificity.
yes, few false positive, high specificity. This test is highly specific. Another example, a new test called BRC10 is tested on 10,000 women to detect breast cancer. 8,000 of these showed negative BRC10. So now they are talking about a negative
Right. So high
test.
negative.
So most
Yeah.
likely the answer will be about sensitivity.
Sensitivity. So they are high negative.
7,800 were truly negative on breast biopsy. So is it a highly sensitive or low sensitive test?
So it's a low sensitive because they're high negatives.
Out of 8,000,